So you are probably all wondering, how did I start treating diastasis recti? Well, before I tell you how I got started, I'd like to tell you why I do what I do. When I discovered the condition, diastasis recti, when working with pregnant women, all I could find was the definition. There was no treatment protocol. The medical community has ignored treating the condition diastasis recti. I don't know why. This condition has just been ignored. It's common knowledge that the abdominal muscles support the back and support the organs. When they're separated, they can't do that. They have to be together to support the back and support the organs. When they're separated, it's now the weak connective tissue ineffectively supporting your organs, which is why they move forward, and your back. The medical community has not gotten the connection between diastasis and back pain, with the muscles separated, diastasis and GI disorders, with the organs moving forward and then out of place, and diastasis pelvic floor problems, because there is a connection between the abdominals and the pelvic floor, and diastasis and C-section, because when the muscles separate, the uterus will tilt forward, putting the cervix pointing sideways instead of downwards. So practitioners don't even check people for diastasis. So my goal is to bring diastasis awareness to the general public and to the medical professionals. Right now, women are told that the only way that they can treat a diastasis is by having a tummy tuck. And with a tummy tuck, that is a major surgery where they cut you from hip bone to hip bone and they lift up the skin, right? And basically what they're doing is bringing the connective tissue together and sewing it. Now, if it's weak connective tissue and you put force on those stitches after the surgery, then they're going to come undone, and I've seen this several times. So what I'm wanting to bring in awareness is that diastasis recti can be treated without surgery, because treating a diastasis is all about healing connective tissue through positioning the connective tissue with our diastasis rehab splint, positioning the muscles, because if the muscles are here, they're going to move sideways. So the muscles have to be together to move in the right direction when you do the exercises. So positioning, protecting the connective tissue. We don't want to stretch it forward. We don't want to stretch it sideways. And strengthening both the connective tissue with our seated exercises and the muscles. So that is the protocol that the Tupler Technique has created for treating diastasis. So now let me tell you how I got here. When I came to New York, I started teaching exercise at a local health club, and they said, "You're a nurse, you should teach the prenatal class." So I'd always wanted to work with pregnant women because I had never done that working as a nurse. So I jumped at the opportunity. And when the women in the class found out that I was a nurse, they started picking my brain about labor. So I became a childbirth educator. In the process of becoming a childbirth educator, I realized that childbirth education comes at the end of the pregnancy and only prepares your mind. Now, you wouldn't run in a race and not train for it. Why would a woman do the hardest thing she's ever going to do, labor, and not have that mind and body connection? So I started Maternal Fitness to prepare women for the marathon of labor, to teach them how to push with their abdominals and relax the pelvic floor, and to keep the diastasis as small as possible. Well, what I found in teaching the maternal fitness class, which was 6 weeks, we would check the diastasis in week 1 and week 6, and what I found was that as their bellies were getting bigger, the diastasis was getting smaller. So I thought, wow, this is pretty amazing that we can actually make the diastasis smaller during pregnancy. So one of my trainers said to me, gee, you ought to get research on that. So I contacted Columbia University Program in Physical Therapy and said, would you like to do some research about this? And they said yes. And basically the research was with pregnant women, the group that did my program, the Tupler Technique, and the group that did nothing. And of course the results showed that the people that did the Tupler Technique had a smaller diastasis. So in 2009, when men were coming to me and the mothers were asking about the children with the diastasis, I thought to myself, gee, if I can make a diastasis smaller during pregnancy, just think what I could do afterwards. So in 2010, I started Diastasis Rehab, and I am now treating women, men, and children for diastasis. I'm still preparing women for the marathon of labor because it's very important to do the Tupler technique during pregnancy. And I'm also helping people prepare for abdominal surgery so that they can maintain the integrity of the sutures afterwards. So now you're up to date, and I hope you enjoy looking at the website, and if you have any questions, please feel free to contact us. Thank you.